Icon Cancer Centre care for thousands of patients per year, offering a wide range of radiotherapy options to treat many different types of cancer. Superficial X-ray therapy, or SRT, is a simple, non-invasive technique. It uses gentle, targeted radiation therapy to treat a range of skin conditions. These include non-cancerous conditions such as psoriasis, chronic eczema, itchy skin disorders, hemangiomas, and keloid scars. SRT can treat many types of skin cancer, including basal cell carcinoma, squamous cell carcinoma, cutaneous T-cell and B-cell lymphomas, Merkel cell carcinoma, lentigo maligna, and Kaposi sarcoma. For some people, SRT offers an alternative to traditional surgical methods such as cutting out the cancer or Mohs surgery. Many patients may worry about how they will look after surgery, while doctors focus on how well the treatment works. SRT offers both effective outcomes and reassures cosmetic results. It can also be a safer option for people who may not be suited to surgery, such as older patients or those taking blood-thinning medications. The BEBIG Medical WOmed T-105 SRT system delivers fast and effective treatment while helping patients maintain confidence in their cosmetic outcome. The treatment also reduces downtime and avoids the need for skin grafts or anaesthesia, helping patients return quickly to their usual routines.
Hi, my name is Gerald Fogarty. I'm a radiation oncologist. I trained at Peter Mac in Melbourne. I have a special interest in the disorders of skin and benign conditions that can be treated with radiotherapy. In terms of academic qualifications, I've got over 200 publications, a H-index of 32, and an OAM for services to medical research. Superficial radiotherapy comes from a machine. Those machines were made in the early 20th century, so it's been around for at least 100 years, and it's been a great modality to use, particularly for lesions that are superficial, as what the name says, which are mainly skin cancers and also other cancers that are close to the surface of the body. So the WOmed system is one of the latest innovations of superficial radiotherapy. Superficial radiotherapy is a wonderful modality. We use it a lot. There are some great advantages in superficial radiotherapy as compared to linear accelerator radiotherapy. The good thing about superficial radiotherapy is that you can actually identify the target and treat the target as it's visible, whereas using linear accelerator radiotherapy, you need to use bolus in order to get full dose on skin using the megavolt. So I really prefer using the superficial for some cancers because that way I know my staff are getting the field completely exactly right every time. Some of the radiotherapy machines were a bit clunky, didn't have the great maneuverability that their system has. We find that this particular system is easy to handle. There doesn't need to be much strength or dexterity from the radiation staff. There's no special need for special qualifications in terms of physicalness from our staff. Anyone can use it. It's a very durable machine. The amount of maintenance we need to do on it is very little. In fact, I don't think we've ever needed to call people in an emergency situation. It's always been standard maintenance. And so that's really good for us because uptime is everything. Being mainly involved in private radiotherapy, one thing that private patients hate doing is waiting for machines to come live again after an unplanned breakdown. But that really hasn't happened with the machine that we've got here at Revesby. Time in room is really what is important in radiotherapy. So if you've got a need to put bolus on and then verify where the bolus is, that just adds to time in room. And so that's from an economic point of view. More importantly, from a patient point of view, time on bed is much less. So that rather than having to verify the position all the time, the patients are treated quickly and simply. The good thing about the maneuverability of the WOmed system is that you can treat people in their wheelchairs, you can treat them in a normal chair, you can treat them even in their hospital bed. So there's very little need for transfers. Well, the WOmed system is like other systems. What they appreciate is just the quickness of being in the room. So they're in the room, treated and out straight away. Also, calculation time for the beam deposition really depends on the skin source distance, and the WOmed does have quite a generous area of treatment, so we don't really have to go to extended SSDs, which just prolongs the treatment time. The good thing about it is that we do planned maintenance on it, so we know where the dose is going. There has been a problem even in Australia where sometimes the calibration factors have drifted off, but our physics staff have a WOmed fleet. They're very used to doing the calibration and the maintenance on that, so we know what we're delivering when. And I think from a doctor who's prescribing that sort of treatment, it certainly gives me a lot of comfort to know that the patients are getting exactly the same dose, the dose that I prescribed. One thing that I like about the WOmed system is that you can alter the filtration, and so you can treat to the depths where the pathology is. So this enables us to give someone who perhaps has a very thin cancer a very different treatment journey than someone who has a thicker cancer, or even someone who has a benign condition that goes to quite some depth in the skin tissue. What's important also is the manoeuvrability of the head of the machine. So having a great manoeuvrability means that we don't need to get the patients in positions that they may not be able to support for quite some minutes of the treatment time. So everyone's comfort is adequately catered for.
So my name is Suen, and I have been with ICON for almost 5 years now. I'm an advanced radiation therapist. So in ICON Centre, we actually give patients X-ray treatments to help them to cure the cancer. The WOmed system is extremely easy to set up. From the machine to the software, it's extremely user-friendly. The treatment usually takes roughly about 10 to 15 minutes, so it's very efficient. The most enjoyable thing is the WOmed system. It's extremely compact and mobile. It is very easy to use. It is quick, simple, and very easy to set up around the patients. We treat a lot of elderly patients here, and a lot of them are not very mobile. So the WOmed machine can actually easily set up around them. The patient usually just has to expose the actual treatment area, and that's about it. They don't really need to take the clothes off or things like that. WOmed actually comes in various size of the cone size and also the lead shielding size. So it is quite easy to match to the doctor's treatment size as well. And also the WOmed machine comes in 4 different filters inbuilt in there, so the doctors can easily pick how deep to treat the actual tumour.
My name is Dane Mumme. I had a squamous carcinoma to begin with, which started off as a tiny white dot, and to be honest, it was there for about 2 years. It was starting to get out of control, and I went to the skin doctor and they tried to cut it out and they missed a tiny bit, and here I am. Every day except the weekends for the last 4 weeks. In my sort of field, it has affected me a bit, being a concreter, which is pretty heavy work as it is. By 12 or 1, I've had to have an extra few coffees or an extra Red Bull. Just a little bit of, you know, a bit lethargic, I guess. But being on my lip, I can still manoeuvre things. Not extreme deep pain or anything like that, just a bit of stingy, kind of burny. I keep saying to the technicians here, it just reminds me of an extreme sunburn. That's the best way I could describe it in regards to like pain. If you were to fall asleep at 10 o'clock at the beach and wake up at 4 o'clock on a hectic Australian day. Paw cream is my thing, but I mean, I guess you could have a Nurofen if you wanted to, but I haven't.